Good morning, everyone. Welcome to day 3 of Acharya Rat Connect 2025, a premier online webinar series dedicated to advancements in medical imaging organized by Department of Medical Imaging Technology, Acharya Institute of Allied Health Sciences, in association with Indian College of Radiological Technology. I am Rizwan, your host for today. Without further ado, let me introduce you all to our speaker for today. We have with us Mr. Prakash Umbarkar, Executive Senior Radiation Therapist at PD Hinduja. Sir brings with them a wealth of expertise and experience in the field of radiation therapy. Sir is an active member of several prestigious national and international organizations, including the ARTTI, ISRT, ESTRO, and the WRETF. In addition to his clinical works, Sir also holds a vital leadership role as the academic coordinator of the Association of Radiation Therapy Technologists and has been nominated as the ambassador from India for the World Radiography Education Trust Fund, reflecting their outstanding contributions to global radiography education. Prakash Sir was also honored with the prestigious international award at the 2018 ESTRO Asia International Conference in Singapore and has authored 7 publications, including both national and international papers. Furthermore, Sir serves on the International Advisory Board and Editorial Board of the Radiography Journal and is a regular abstract reviewer of the ESTRO conference. With such an extensive background, we are incredibly fortunate to have Prakash Sir with us today. Let's all give Sir a warm welcome as he takes over for this session.
Thank you so much and welcome to all our webinar series. Namaste and thank you for the wonderful introductions. Basically, the previous, the Madam Gayatri and Miss Reddy Madam. So I attended both the webinar. It was very nice and elaborate session for the previous. I am going to talk about the combination of the radiation therapy and the radiology, the technique, how radiology techniques to use as a radiation therapy in the treatment purpose. Without radiology, we cannot sustain or we cannot go for the further treatment in basically in the cancer and the diagnosis field. Okay. So I will share my screen. Okay, thank you so much. So I will talk about the recent advancement emerging trend in the radiation therapy and imaging. So I will basically highlighted my presentation today, the overview of what is the evolution in the radiology and what is the evolution in the radiotherapy, technological advancement in radiation therapy and the radiology, what is the new trend in the radiology and the radiotherapy, and what is the combination like professional development and lifelong learning, patient care and the safety and the daily practice and future direction. So I will basically highlight it in my presentation next 45 minutes. Yeah. So as we know, the medical imaging technology is a significant role as early detection, the treatment planning and the patient management. Nowadays, we observe that many of the new trend also. But the combination of the radiology with the help of this imaging technology is a vital role of the diagnosis of the treatment. Means what are the imaging you are taken for the diagnosis purpose, we help for the finding the diagnosis, and based on the diagnosis, we treat the patient. Idea like that, the diagnosis imaging. But continuously advancement in enhanced accuracy, speed and the safety of imaging, we are tremendous changing the evolution of the imaging technology. We observe that continuously our professional growth is high standard and critical practice and the patient care and research. We also the significant the advancement in observe that in medical imaging. Today I will main focus my presentation What is the advancement of the technological in radiology and the radiation therapy? What is the best practice we are following in world or international? What is the common and the new trends in we are past to till date of 21st century, and what is the career path both the profession in radiology and the radiotherapy will discuss in next the slide. So as a fundamental, if you see the radiology and the radiotherapy, because we are the both the profession working for the patient, like radiology and the radiotherapy. If you see the in my screen, the both the imaging and the therapy part. As a radiology, imaging techniques and imaging diagnosis for the X-ray, CT scan, ultrasound, and PET-CT, and the advanced modality of the PET-CT imaging. Radiotherapy, we are using the high intensity radiation beam or external or internal radiation therapy, use of the different technique treatment delivery. But if you imaging this technique and fusing this technology to deliver for the radiation therapy, we are using for imaging in cancer treatment delivery also. So coming to my main points, as a target audience today is most of the radiotherapy and the radiology technologies. What is the role of radiation therapy technologies and radiology technologies? As of now, we know the perform the imaging procedure like CT scan, MRI, and the ultrasound. Most common the radiology technology is done. Patient position equipment operator, that is radiology technologies. Patient safety comfort, that is very important while taking the imaging and the doing the procedure, and assess the radiologists. Common the modality of the imaging technology: X-ray machine they handling, MRI imaging handling, CT scan operating, and ultrasound operating. Let's just talk about the radiation therapist. We are the radiation therapy. We generally treat the patient. We also operate the linear accelerator, deliver high precision radiation dose, and collaborate with always radiation oncologists and medical physicists. We also the well deliver the radiation, treating the patient, always monitor the patient side effect, and we give the provide the supports and ensure the care of the quality of treatment. Then we have the both the profession, we work together for the worldwide patient care and patient care, right? So what is the evaluation in an advancement in medical imaging? So if you see the X-ray, that is a Ranjan or discover, or who is the discoverer in the X-ray, first X-ray in 1980 or 80 series, and we come up the hybrid technology or the AI generation with the advanced technique modality, we observe that. Current advancement, if you talk about the computer tomography, magnetic resonance imaging, and the ultrasound, there are the commonly we are using for the imaging technology, and this is the advancement we observe that in medical technology also. But if you see the X-ray film where you start our journey, so look at this my screen. This is a dark room. We are taking the image, but that time we know how much exposure to give the patient and how much the quality of the images we don't know, because this is a long process to acquiring images, develop the films, and see the diagnosis. This is scenario in history time, but now changing the evolution of the technology, like in the digital world, dark room to the digital room, that is a growing technology in X-ray film. If you take the picture immediately within the fraction of second, we get the very clear images for the any anatomical region, and we get the faster imaging. We also record the dose and how much patient receive the radiation. So everything is a technology come up the together. We get the data and the finest the imaging quality in the new era in the digitization in the medical imaging. If you see the timeline, that is a very good the paper. We can see the in the Google and search. They give a very fantastic overview how we evolve the technology and improvement our imaging technique, imaging quality, patient safety, and reduce the patient dose to the imaging in various aspects. The many physicists, many imaging radio diagnosis, the scientists involved and the changing our world to the for the imaging technology. So current top technology, that is wide bore MRI, because earlier in the very small bore size in MRI, patient is very discomfortable because of the bore size very small. Now is the market having the very fantastic open MRI, wide bore MRI for the more comfortable patient. CT scan, the faster imaging, DEXA scan for the bone, and the digital X-ray. We can roaming anywhere from the patient in the bed or patient in ICU. So we can take the X-ray in very point and open MRI and ultrasound. That is a fantastic imaging technology. We observe that in imaging technology, demanding changing the globally and internationally for the patient, the diagnosis and accuracy purpose. So then this is the technique, but now there's another world, that is AI generation. AI generation come to the reporting system, then hybrid imaging, the telecommunication, 3D printing, and the virtual reality. We can see the inside the patient, what is the movement on going on, real time adaptation. We are the now imaging trade. We observe that in the medical technology also. So coming to the main point in my radiation therapy. So what is the radiation therapy? If you talk about, I know the most of the in the radio diagnosis people, but I want to highlight the what is the radiation therapy. So in radiation therapy, basically we are using the ionization radiation to treat the cancer patient. Radiation work to the destroy the cancer cell and they kill the cancer patient during the particular area and deliver the treatment. But as of now, most of the Indian the data, 60% of the cancer patient need to radiation therapy. Either patient is curative and either patient is a palliation treatment. Both the treatment purpose, we require the patient for the radiation therapy. Common cancer in world data say that breast cancer, lung, colon, and the prostate cancer. But advancement of the without diagnosis, we cannot run the radiotherapy. Remember that if you take the good quality of image, if you take the diagnosis image, if you good the finding based on we are the implement of the therapy of the patient, but we require the good diagnosis, we require the good pathologic report, we want to the good surgery and good the additional supplement treatment modality as the chemotherapy to increase the quality of life, to increase the cure rate of the cancer patient with help of this new technology. Again, if you see the history time and at the 21st century, demand is changing the technology wise, but it is definitely is a benefit of the patient. What is the benefit of the patient? To increase the dose to the tumor volume and minimum dose to the surrounding tissue. While delivering the radiation, we know that everyone radiation is hazardous for each and every human body. If you unwanted dose receiver or unwanted part to the receiver the dose to the radiation, maybe is harm for the patient and lose the quality of life. So we require the precision and accuracy of the treatment delivery. But without multidisciplinary approach, we cannot run our radiotherapy treatment. Like your department, radiodiagnosis, radiation therapy technologies or radiology technologies, without performing, we cannot get the quality of image. Similarly, we also work together as a radiation oncologist, medical physicist, surgeon, and we care of the patient. So again, what is the use of the use of radiation therapy? Suppose you are taking the X-ray, that's okay. That is your duty is finishing. You take the image, but in our field, the X-ray, that is hard X-ray, we are using the therapeutic purpose. Basically, the radiation therapy cure the cancer, destroy the tumor cell, and what are the microscopic disease in the patient body, we kill the patient with the help of the radiation. We reduce the palliative symptom, the pain during the treatment, that is use of the radiation therapy. Then how work in the radiation therapy in the human body? Look at this image and everyone's aware about the DNA pattern. How to break the DNA when the radiation goes to the patient body means radiation therapy work by damaging the DNA within the cancer cell and destroy the ability, reduce the causes in the cell death. So that is the main purpose of working the clinical practice in how radiation work to the together. We are also changing our world in radiotherapy. In 80 series to today 21 series are also the machine changing, the technology changing, and the machine equipment also changing. But it is help for the everyone worldwide the patient treatment. We are also observe that two dimension to the three dimension and the modern treatment technology. Most of the we are also together working the same department and the collaboration of the radiotherapy, IMRT, IGRT, tomotherapy, cyberknife, or proton therapy. Everyone's known about this terminology and the treatment technique, but it is a more benefit of the patient treatment. So what is the benefit of this technology to reduce the normal tissue dose? We don't want to the extra dose to the unwanted the healthy tissue. So we have to target only the normal tissue as well as the radiation therapy treatment delivery. Suppose this is the tumor volume here. We don't want to the surrounding the normal tissue dose. So only focus the target area and deliver the radiation. So these are the treatment technique help for the patient and cure the cancer patient in effectively in various manner. So as in the radiation therapy, we want to the good control of the tumor. We don't want to the any complication related to the radiation therapy. So only the possible as a radiation therapy technologies, we want to the precision and the accurate treatment delivery. But while delivering the precision and accuracy, these two terms, the patient positioning is very, very important. As our main principle of the radiotherapy, maximum dose to the tumor volume, minimum dose to the surrounding tissue. Only the way, if you the position in the patient appropriately, effectively, and the reproducibly, we can achieve this, the goal of the radiotherapy. So let us talk to the coming to our main agenda of the today's my presentation, the technological advancement in imaging technique in radiation therapy. Because most of the student today join in online webinar, someone working in the MRI, someone having the CT technology, someone having the PET CT department or ultrasound imaging. This imaging we are using for the radiation therapy purpose, because we are taking the images for the spine, brain, or any particular area. We want this imaging for the more clear confirmation and the target volume. Suppose I will give the one fantastic example. Those are working in the CT scan department and you take one brain MRI images, brain CT scan images and compare with the CT scan imaging. If you see the significant difference between the two images, like CT scan images, we cannot get appropriate in the imaging quality and good anatomical information in CT scan images. But if you look at the MRI brain scan, we get all the parameter, the good enhancement of the anatomical and the better visualization in the disease and tumor and any changes of the brain, we get only the MRI. With this imaging, in the radiotherapy CT scan and our simulation, we fuse together this. Fusion means one is your MRI images, one is our planning CT scan images. We superimpose. Superimpose means suppose we not get any clear lesion in the CT scan images, but MRI we can identify in the T1 contrast, T2 contrast, or T1 flare imaging or diffusion images. We get the more clear boundary of the tumor. So if you mark the tumor volume, if you contour the proper the target volume, so we get the correct way the treatment delivery. But if you not seen the lesion, without seeing the lesion, we cannot treat the patient. Suppose if your marking is wrongly drawing or the contouring, indirectly we give the insufficient margin or extra margin. If you give the extra margin to the volume, means you get the more radiation to the normal tissue also. So we want to the clear imaging. Either we can use the PET CT imaging, either we can the use for the FD imaging or the high quality of enhancement. So we get the more information. So your imaging, it is more essential for the radiotherapy technology. Then we also the new trade in radiotherapy, image guidance in radiotherapy, 4-dimension treatment, proton therapy, MR linear, and the flash therapy. We are also using the AI system for the treatment planning. And last one, patient communication, very, very important while delivering this new trade in technology. So look at this screen. There are the three new technology in India and abroad we are using for the cancer treatment. First one is the MR Linac. MR Linac, like our MR Linac, we get only the imaging. But nowadays this MR Linac with the combination of the linear accelerator, we take the images and also same time we deliver the radiation. Proton therapy, that is a much advantages of the treatment modality treatment and the treatment delivery pattern, and the carbon ion therapy just trial going on the abroad. We not use the nowadays in India in the clinical practice, but this is a new trade of upcoming in the future. Maybe some center also buy for this technology also. So look at these MRI images. So what is the main advantages in the radiation therapy in MR imaging technology? I told you this is a combination of the MRI and the linear accelerator. If you see the tumor, you can treat the patient. We get definitely good quality of imaging with the help of the MRI imaging. So we can real time, real imaging, track the tumor and treat the patient in MRI technique. So this is also the new groundbreaking technology in radiation therapy. So look at these images. Patient is lie down in the MR scan. This is a tumor. Machine is rotated around it. Accordingly, the patient breathing pattern, treat the patient. So we cannot get the extra dose to the any organ or any particular area and we expose the patient. This is the beauty of the MR Linac in the radiotherapy. So most of the radio diagnosis people, they observe that while patient is breathing, while is swallowing and digesting food, we cannot get the clear MRI images. But as a modern, the MRI machine, they very sharp and the shorter treatment, shorter the time they can take the images and acquire the positioning, the appropriate lesion, and we take the images for the MR Linac also and treat the patient. So that is advantages of the MRI Linac in the radiation therapy. And as of now, we know how important in the diagnosis also. Most of the CT scan images, you tell that patient, please hold the breath because we want to the HRCT. Like where also the patient while breathing, the tumor is moving accordingly breathing pattern, like breathe in, breathe out. So this is our tumor. Accordingly, patient is breathing, move up, move down, the tumor is moving. We want to the exactly the target positioning. But if you hold the patient breathe and appropriately exactly target, we deliver the radiation. So this is also the tracking and the getting the images with help of the new technology. Yes, we observe that what is the technology important in the radio diagnosis, what is the technology important in the radiotherapy, but both the profession while treating the patient, while acquiring the images in the imaging technology, very, very important patient safety and the comfort. So what is the strategy and what is the innovation to imaging procedure, daily practice we have to follow at the both the profession. So I will share you some slide main highlighted how comfort during the treatment, how comfort during your imaging procedure, because we want to the perfect positioning, we want to the patient comfort, and we want to the good quality of the imaging. So while taking the imaging in your radio diagnosis imaging, Very, very important parameter, patient safety first. Don't forget our principle because critical evolving the medical imaging. We want to the balancing precision care. We have to use your technology and the human touch because we are always work together in the for patient care because patient safety important for us. Reducing the anxiety. Suppose patient coming for the MRI scan. If you see the patient, the pediatric patient or the geriatric patient, some patient having the anxiety, phobia, they cannot go the small bore size. The patient having the anxiety. Even CT scan while pushing the contrast, putting the needle, patient having the anxiety. So we cannot cooperate the procedure. And we, if your patient is moving the treatment, moving your imaging procedure, we cannot get the more appropriate imaging. And we have to get number of times or multiple times if you take the imaging, so we get the extra dose to the patient. So make sure patients should be comfortable while taking your imaging. And latest innovation. What are the imaging advance? We have to utilize your the daily practice. So why safety is matter? Ask everyone to question to everyone to itself why safety is matter because definitely imaging help the diagnosis problem. Any imaging, if you have the problem, you take the imaging, we can identify your problem. But as every professional done by the very carefully and safely. If you are not doing the properly, not ethically, not following your standard protocol, the possible risk for the patient, too much radiation due to the X-ray film or your CT scan. Reaction to the contrast agent, that is also important. And if you are not following, you take the long time and during the duration of the scan, unwanted exposure of the patient. Then how to stay safe? We have to follow the safety rule. We have to follow our ERB rule. We have to follow our radiation professional rule, and we have to follow the what are the your institute develop own protocol for your daily practice. Then well trained staff because we want to the expertise. Yes, the student those are the taker for the medical imaging. Everyone's not understand this protocol, but as a senior diagnosis people, they have to learn, they have to teach them what is important for the safety point of view and how to utilize your better technology in the new machines in the safer and the more and patient communication. That is also important because if you effectively the patient care, if you dealing with the patient communication, we definitely reduce the patient anxiety, stress, and patient definitely help for the patient. Look at this, the pediatric patient, 2 years or 1 years old child, they not cooperate your procedure. But if you talk the patient, rapport with the patient, we can reduce the anesthesia dose, and without anesthesia dose we can acquire your images. So this is the quality we have to inbuilt in each and every profession. Those are handling the care of the patients. Number one, how to ensure you are the safety of the patient. Don't forget your the rules. That is a safety rule. Keep as Alara principle, always keep in mind as low as possible radiation dose to the patient. We don't want to the extra dose to the patient and less amount of radiation received and get the very good of the quality of image. Monitor of the radiation level, like what are the how to measure. If you have the dosimetrical equipment, we can use and tackle your situation and measure your radiation dose to the patient, and you are the safety. That is the thumb rule and the gold rules for the each and every profession, like radiotherapy or any imaging diagnosis. Those are involved in the radiation field. Again, third important, the proper use of the contrast agent. Why is important? While preparation, that is one step. While loading, that is one step. And while pushing contrast, that is also important. If you look at the two needles or two contrast agent, one is a normal saline and one is a contrast agent. Small bubbles If you're not checked, and when you're pushing the patient body, what happened to the patient body? What is the complication? If you observe that, so that is dangerous for the patient life also. So before the contrast agent, each and every profession, yes, doctor always check the clinical history or medical history like kidney disease or any before contrast, avoid the bed reaction, everything we have to check. Stay hydrated the patient. That is also important with the via communication, and we can guide the patient, and we can ask the radiologist also. They can also help for the patient. That is very important for the each and every those are involved in the contrast agent delivery of the acquiring your CT scan imaging. Last, inform the consent patient education. We don't want to the extra time for the communication, because everyone know about the suppose someone our patient is all educated, most of the patient educated patient, they search in the Google and all the information take out and they ask the many of question. But we want to the clear proper communication, because the social media give the multiple various factor and various the wrong information. But if you the clear information, what is the purpose of the PET CT imaging, what is while CT scan delivering, acquiring, what to do, what to not do. If you give the clear communication, patient should be understand, yes, this is my CT scan images, what purpose they are taking my images, and what is benefit from taking about the CT scan, and what is the benefit from my diagnosis finding. If you give the communication by the radar diagnostic technology, patient also happy. Again, legal aspect, patient consent very important. What are the consent in developing your institute? We have to clearly mention, clearly read the patient, and they can clarify the any related the problem. We can ask the question, get from the feedback from the patient, so patient also the understand the what is the procedure going. That is very important for the day-to-day practice we have to follow. Sometime nowadays the hospital engaging system, that is give some patient, the institute give the written exam instruction, some the institute give the audio video visualization, what the imaging technology, so patient also understand the what is the MRI, what is the PET CT image, what is the X-ray imaging. So we get the more patient education related to the you are the imaging technology. Basically we want to the patient comfort prior of the treatment. That is main the goal of education, the prior of the your procedure. So best practice in imaging and quality, how to implement your best practice in quality of the safety. Both the profession, because I am the radiation therapy background, you are the radiation diagnosis background, we want to the both the patient immobilization positioning. If you not get the appropriate positioning during the procedure, maybe we not get the clear imaging. So we want to the both the profession, the quality before of the imaging, patient positioning, immobilization, very important. What immobilization your procedure? Patient should be comfortable, neck raise, the leg positioning, so patient cannot move the during the procedure. Radiation dose optimization. Don't forget again the ALARA principle. Use low dose protocol, either CT scan and the fluoroscopy imaging. Try to minimize the radiation dose to the patient, and justification optimization strategy in the pediatric patient. What purpose you are taking this imaging? Really work for this imaging purpose? Then ask and then proceed of the treatment. Then standard protocol, what are the ERB give the standard protocol? What are the give the IA protocol? What are the give the ICRP protocol? Just follow and implement your daily practice. And accordingly adjust your protocol and implement your SOP also. We want to the quality of the treatment, but we want to the quality of the equipment. So always routinely check your the daily basis or monthly, weekly your equipment. So whether is doing the performance weekly, they give the properly quality of the images. You want to the everything parameter check accordingly your institute protocol. That also can help to regulate your the standard of the imaging procedure. So we are also the following the radiation therapy, the some protocol, that is radiation safety, that is ALARA principle for dose optimization. We are also the radiation therapy, the standard protocol, ARB, ICRP, and IE guideline. Patient position strategy, we also following the best practice, and quality also assurance, that is calibration, phantom, dose monitoring daily basis via the quality check of the equipment also. Now look at this very important, and this is awareness program. Like in American society, they are developed for the choose wisely, image gently, and image wisely. So basically, these three tools, while taking the imaging as every profession in the diagnosis department, we have to ask what is the purpose of this the imaging, what is the modality for the patient, and what is the pediatric patient, because we cannot same the protocol apply for the adult patient to the pediatric or pediatric patient to adult. So appropriate the imaging protocol we have to follow, like choose wisely, image gently, and image wisely. So image gently basically for this protocol for the pediatric patient, and image wisely for the general population. And but before taking that's image gently and image wisely, we have to avoid unnecessary the imaging, because 10 days back you take the check x-ray, and after that you just visited for the second day in another hospital for the second opinion, and the doctor also the same test we have to prescribe. So we don't want to unnecessary exposure the same site and same location. So that is also choose wisely, that is our clinician decision. Then choose wisely, we can ask the question, so what is the risk for the while taking the double imaging? Really need for this imaging or repeating imaging, are a similar or the same option, or we can alternate, can use for imaging. Suppose there is a simple imaging, if you want to the finding the node, simple node, we can use for ultrasound. Why you go for the CT scan? So we can choose accordingly how can avoid the minimum, how can avoid the radiation dose to the patient with alternate solution. So this is image wisely. Then again, very important, image gently for the pediatric patient, because if you see every patient not for the same size, every patient having the different thickness. Like pediatric patient, if you compare the elderly patient, we cannot use KVS, same KVS or same MAS value for the pediatric patient. So that is very important while taking for the patient, like especially the kid patient, for the imaging. So children are more sensitive for the radiation. If you give the extra dose to the patient, pediatric, maybe he is developed for the cancer also. So make sure adjust your the KVS value and MAS value while taking the your fluoroscopy or CT scan image, and avoid unnecessary radiation dose to the patient. So I will give the small example, choose wisely, image gently, and image wisely. Suppose if you have the minor headache, simple headache, no serious symptom, and your doctor might order to CT scan, avoid unnecessary to the radiation to the CT scan. We don't want to the CT scan for the minor headache. If you have the major headache, big problem, then we'll think about the your CT scan or MRI images. Another important, that is second important, if your child is fall and had a mild injury, if you using the ultrasound images, we can identify your problem. Why go for the CT scan imaging? We don't want to unnecessary dose to the patient also. Third, even important, image wisely. What is example? Smoker in the high risk of the cancer. We can use low dose of CT scan and rectify the problem. So that is also important, how right time, right imaging, and the right way we have to utilize. Okay. Another important example, after the minor car accident, there is no symptom for the patient. Doctor decided not to do whole body scan, only the avoid unnecessary radiation. Immediately for the kid patient, mild twist in injury from the playing the sport. Simple X-ray we can take and finding the problem. We don't want to the CT scan imaging. So we can also the carefully for the while image gently protocol we can use. Image wisely, instead of the full body scan, like the heart patient, MRI, or we can use for other patient, other modality, to unnecessary avoid the radiation dose. So basically, we have to think each and every profession really worth for the imaging. I can reduce my exposure to the patient, but we have to knowledge of your the this protocol. Then you can implement your department also. Then always the follow the traffic light, because in radiation profession we always in radiotherapy department traffic light signal, like we have to see the patient, verify and the treat the patient. Similarly, we can also develop your the traffic light protocol. Like in my suggestion, each and every diagnostic technology, the first step, verify the patient information, patient name, because sometimes the diagnostic department, many of crowd in the like government hospital, and they are crowded hospital. So we have to verify the first step, that is the patient information. We want to the right patient, right way in the imaging protocol. Verify the patient photo, whether it's correct patient inside or you are doing the correct way. ID, what are the hospital give the ID, verify. Prescription, what are they given the doctor prescription, we have to follow. Which site to acquire the scan and the report privacy. We can this traffic light, we can develop own way, or we can develop your checklist to avoid unnecessary incident due to the radiation or unwanted the radiation to the exposure of the patient. We can follow the checklist. Then each radiodiagnosis and the radiotherapy, each and every profession, each and every both the radiotherapy technologies and the therapy person and the diagnostic person, there should be minimum knowledge as a radiological imaging technique and interpretation. This is very important for the radiodiagnosis technology. Important of the radiation safety in radiation therapy and radiology. We want to the both the profession. What is the radiation therapy in radiotherapy? What is important radiation safety in the radiology? There should be thoroughly the knowledge of the radiation safety. Understand the diagnostic imaging equipment. What are the imaging equipment in your department? You should be understand each and every part, each and every technical skill, each and every what are the parameter. You should be understand and thoroughly knowledge of the equipment. Knowledge of anatomy, very important. Without anatomy knowledge, we cannot acquire the imaging and we can use a different imaging modality. We have to understand which protocol used to the right way, the right patient. Knowledge of the treatment planning and the delivery. And last one, both the profession, communication, patient skill and radiotherapy and radiology, important. That is very important, both the profession. But look at this, both the profession, how bridge the together. Because while moving forward, there is some system that is learning and the de-learning. If you think about the developer of X-ray, we don't want to this technology because we have to adapt the new technology. When you go for the history, yes, history we can read, we can understand what people they are going to the in the previous day, but now we are moving to the learning phase. So continuous learning, stay update, rapid technology. Both the profession, those are the new radiotherapy or the new diagnosis people. We have to learn new technology, update yourself, because now changing the world, changing your technology rapidly in advancement. Interdisciplinary collaboration. Always, if you are working in the radiology department, you have to collaborate in the radiologists. You have to really, work with the radiation oncology, physicist, and the AI specialist. Why important? Because sometimes my department don't have the dedicated CT scan images. My department don't have the MRI images, MRI machine. We have to go your department. So I have to collaborate your department, because we don't understand, you people not understand the radiotherapy. Sometimes I don't understand your protocol. We have to collaborative knowledge exchange and to improvement for the patient quality of the accuracy of the treatment. Certificate or accreditation. Now globally available in IRT certificate, JCI, NABH, IA, we have to follow and involve the research and knowledge. Encourage your the clinical trial, publication and the technological advancement. Why important? because you are the boss, you are the boss your field. You have to share your knowledge via your the clinical practice, your publication. If you are the finding the novel, even your practice, you have to share even the worldwide, because we are the exchange of the knowledge via the various platform. That is very important. Then what is the common groundbreaking and how to bridge radiotherapy and the both the profession? Like both the profession require the understanding anatomical information, medical terminology, and the patient care principle. That is very, very important. Both the profession. Without anatomical knowledge, we cannot treat the patient. Without anatomical information, we cannot acquire the imaging. We should be understand the medical terminology and patient care. Important, always collaborate in the professional development in various radiology technologies and vice versa, radiology technology also. If you want to develop this, the strategy, improve yourself, always you have to go for the CPD program. CPD program means nothing but we have to continuously improvement your knowledge and knowledge. Either while lecture, attend the conference, small courses, reading, or the journal publication. Like today we are together because I am the radiotherapy background, you are the radiation diagnosis people. We are come together. Like I really appreciate is Acharya Institute of Technology 22 the speaker, they are worldwide, the collaborating and they share your knowledge in various platforms also. So grab this opportunity, learn from the new and implement for your department. Definitely improve your the uplifting the industry, improve your the gold standard practice, and improve your the institutional practice. And it is help at the end of the patient care and the patient care. Then how to grow yourself, because we don't want some patient, someone is very interested in the radiology, someone is really interested in the radiotherapy, but there is the chance to growth or uplifting yourself. Suppose they want someone having the radio diagnostic department, they want to the uplifting yourself, like they can use for the advanced the super specialist field like interventional imaging technology, breast imaging, pediatric, cardiovascular, nuclear medicine. They can uplift, they can move any world, entire world for the super specialist. We have the global opportunity, like clinical practice we can go, academic the institute we can join, and industry sector we can join also. Someone having the brilliant knowledge, someone having the really that's the scientist knowledge, they can take the entrepreneurship, develop the innovation in the technology wise imaging and the radiotherapy department, or the develop the device that is used for the industry. Radiology, the field that is diagnosis, intervention, and nuclear medicine, we can go. Radiotherapy, we also go for the clinical practice, we can go for the dosimetry, we can make a medical physics also, and we can adapt our the AI system also. Rather than there is also the global opportunity, we can go for the international, the fellowship, we can do the collaboration, the clinical practice, and academic research also. That is a multiple opportunity for the both the profession also. But while taking or while making your good practice, always consider ethic and good practice for consideration. Not for the radiotherapy, not for the diagnosis. Both the very, very important. Each and hospital industry, every profession, don't forget the three rules, ethical rules. Inform the consent, confidentiality, and the patient right and the participation. Very, very important. What are the procedure we have to done? We have to explain the thoroughly patient. That is a medical legal issue. Patient rights, they can ask the question, we have to give the appropriate way, right way, that the patient consent. Confidentiality, always confidence the patient information in the premises and the hospital privacy. Suppose you are taking the female patient inside, make a dignity and confidence of the patient, and always patient right and participant, make respect your patient, because patient coming to the hospital, that is for the they are believing us, because patient trust, it is our biggest asset for our the improvement of the quality and improvement over the hospital industry and the career growth also. So don't lose all the patient confidence and the trust, very important. Then future the direction for the both the profession, advancement of the technology. We have to continuously adapt to the technology, emerging trade, and adapt your responsibility and stay updated with the new technology in the radio diagnosis, the field also. So I want to highlight the both the profession, the radiotherapy and the radiodiagnosis profession are the frontline worker. We are the frontline worker. Suppose we are the diagnosis, you are also the frontline worker. Without imaging, we cannot implement in the radiotherapy. So you are the key person frontline. We are also the frontline for the cancer treatment. Stay update, emerging trade. Very, very important, delivering the effective and accurate patient the care in healthcare industry, both the profession. Embracing the technology and advance ensure the best possible treatment and the diagnosis. If you the best diagnosis, they can cure the patient. I am best to deliver the treatment, the patient cure the effectively. So very, very important. That is a thumb rule principle, both the profession. Patient center care should always the top priority in the both the treatment and diagnosis. Don't forget, always patient come and do the effectively treatment delivery and the diagnosis. Keep up and update technology and technique because we want to enhance patient outcome. If you learn the new technology, if you implement your department, definitely it is a benefit for the patient. And last one, continuous learning and the skill development. Each and every healthcare professional stay update and encourage your treatment, encourage your the field also. Bottom line, this Acharya Institute of the Technology, they are doing the wonderful job. This the webinar series important, the power, because the knowledge is the power. If you the grab the knowledge, we have the power. Only possible the knowledge grabbing, the continuously learning and adapting the new profession, excellent driving. If you not learn new thing, we cannot grab the knowledge. Embrace the technology advantage. Now hybrid technology, automation, the world is changing the digital world. So you have to adapt the new feature in the radiology. Safety and the patient first. Follow the best practice, ensure the patient safety and optimal imaging outcome. Very, very important. We have to believe yourself and believe your the patient. Collaboration is the key. Always a strong partnership between the student, educator, and professional floater in the innovation. Exchange your knowledge via student, education, and educator and professional. And future outlook that radiology is evolving the rapidly. Be prepared and to evolve it yourself for the future journey. So bottom line, the today I'm basically highlighted that the grab the technology in the future, new trade, new knowledge, enhance the knowledge because we are the shape of the future of the radiotherapy and the radio diagnosis for the patient, better care and the better care for the both the profession. Thank you very much.
If anyone has any questions or doubts, sir can answer it for you. You can post your questions in the chat box.
And then someone is asking about the proton therapy. Photon, okay. I think Sayed is raising hand.
So one of the
So
questions.
yes, which technique is the best for the prostate cancer? Yes. So very good question. Nowadays, it is a purely the clinical decision. But nowadays, if you see the two-dimension journey to the IMRT and VMAT, if you have the good technology, if you have the good equipment with the image guidance, the rapid air treatment delivery is the most suitable for the prostate cancer patient. So why? Because we are reducing the side effect of the uh, reduce the side effect of the toxicity of the patient in the rapid air treatment. So rapid air treatment delivery is most suitable for the prostate cancer patient. That is also the new technique. Some center are using the IMRT also, intensity modulated radiation therapy also.
So one of the question is, can you tell how using nanoparticles is taking more advantage than using gadolinium as contract agent in MRI?
Actually, sorry, this is purely radio diagnosis question because we don't have the much expertise in this. That if you have anyone have experience, I don't have really experience for that contrast agent. And yes, other than LRA principle, what all the protocol follow the reduce the radiation dose? Yes, basically in the radiation therapy, time, distance, and shading, we are same principle we are following the alara, like minimum in the suppose we are working in the telecobalt machine, if you are using the handling the isotopes, so minimum away from the source and less timing to deliver the radiation and less time to spend in the diagnose less time to spend in the radiation zone, so we can also the reduce the dose to the patient as well as the worker also. How can target tumor cell minimize surrounding tissue? Yes, so this is also very important question. Nowadays there is the multi-leap collimator, that is called as MLC. We can block block the normal tissue cell, so you there is a tumor volume to mark the appropriate mark appropriate the tumor volume and to the shield the other organ with help the multi collimator device. We can reduce the minimal damage of the surrounding tissue also. But again, it's a depend upon the which technique. If you are using the IMRT, it is using the multi-leaf collimator is moving during the treatment, which area they want to the expose, accordingly to deliver the radiation and the normal tissue cells. So only the blocking and the treatment delivery, we can reduce the normal tissue dose also. That is only the way we can save the surrounding tissue also. Then complete BSc, sir. I have the complete BSc radiology imaging technology. I can I can post studies radiation therapy. What scope of radiation therapy? Which modify prefer clinical diagnosis in cancer? Which is modality prefer initial diagnosis cancer? Yes, I think Sayed asking which modality to preferable in initial diagnosis for any cancer, MRI or PET CT. It's again it's a depend upon Sayed the which site having the problem. Suppose the brain patient having the brain problem. So definitely the brain imaging is more superior for the diagnosis purpose. Suppose if you have the lesion in the multiple lesion, so that is a PET CT also the priority to finding the disease or the whole PET scan can also the we can utilize for the diagnosis purpose also. Then difference between the IGRT. Yes, IGRT and IMRT with the application. The difference between the IGRT nothing but that is image guides radiation therapy, and the IMRT is a treatment delivery technique. So IGRT basically what are the images we acquire at the time of the very first first step. That is, suppose if you are acquiring the CT scan imaging, the planning day. That is your the reference, the positioning. And while the treatment delivery, every day we take the images. So we just, prior of the treatment delivery, we just verify the treatment positioning, superimpose the both the imaging and verify the anatomical position. Means your initial positioning and today deliver the positioning before. We just compare with the positioning, correct the setup error and apply the setup error for the initial, that the during the session or the before the session, and that is called as image guidance. We just guide the this before the treatment delivery images and verify the treatment positioning. IMRT, that is intensity monitoring radiation therapy. So this is the technique to delivery of the radiation treatment technique. The proton therapy is still in the testing stage. Does the work? Yes, already proton is already established. The two center in the India. One is Tata and one is Apollo Chennai. We are already used for the clinical practice. What is the fraction and how does help the dose reduction? Yes, it's a depend upon the clinician what they are dose prescription divided. Like suppose the brain is a different protocol, like head and neck cancer different protocol, prostate cancer have different protocol. Generally, the fraction of the treatment daily basis 1.8 gray to 2 gray or a 2.5 gray generally deliver the radiation the daily basis. Some delivery the 8 gray in the single fraction in the palliative treatment, but again it's purely decision in the clinician what they have decided for the particular site and particular disease. They have their own protocol. The proton therapy and hydrogen therapy were the same. Yeah, the proton is a different. Compare the radiography and radiation therapist are more radiation, eat more radiation, how reduce the radiation therapy? Compare with the again, if you compare the room designing and the radiotherapy and the radiodiagnosis, definitely the shielding is bigger in the radiotherapy equipment. And as of now, as a ERB mandation, there is minimum the less radiation. If you observe that we measure that in the survey meter, there is no hardly what are the radiation dose they are measuring. Very less radiation dose to the receive in the particular area also. But nowadays, what are our 1 millisievert that is general publication public for the what I call as the radiation dose, that is only the way in the treatment door area we get the less radiation dose, but in the while sitting the console and operating the machine, we get the very less dose to the radiation therapies also. Compare the more radiation, yes. Because in the diagnosis they are using the soft X-ray, we are using the hard X-ray. Definitely we are treating the more high dose radiation to the patient, and we working the high dose radiation area also. But we have to take all the precaution, the shielding, what are the room designing, the console, everything, the shield and concrete we are using for the ERB approval, ERB approval layout to follow the safety rules. Then, sir, the cancers will grow by the absorption of glucose, taking nutrition. So this is, yes, sir. Do you have the sensor absorb glucose? Yes, yes. If you are the absorb glucose, they are all very sensitive. If you see the FDA or a PET CT, they are using this the drugs. We can see the diagnosis purpose, but that is they are capturing and where is exactly the tumor location we can finding the PET CT also. Then again, complete BSc radiology and imaging technology can do the postgraduate MSc. Yes, we can do the post graduation in the radiotherapy. If you have completed BSc radiotherapy or BSc imaging, we can go for the MSc radiation therapy also. Anyone question? I think most I cover. Hope we understand because I use majority in the radiotherapy and the radio diagnosis system. I don't know how much they are understanding the radiation therapy with the combination of the radiology. What are the subject I choose? Both the profession, it's very important for us. Not for the we are the superior, but you also doing the fantastic job. I always respect in the radiology technologies because you are the first the finding the cancer treatment, the finding the lesion based on your imaging. We are the plan implementing because we are the driving the approach for the what are the decision to give the for the radiation oncologists. Based on the decision, we are implementing the practice in the radiotherapy. So you are the best for the finding the disease in the cancer treatment in the various modality. Someone is working the MRI department, someone working the CT scan department, someone in the PET CT. Without your support, without your imaging, we not successfully implement our radiotherapy plan. So your role is more crucial finding the disease. And yes, definitely, while choosing or while making the daily practice, don't forget your standard practice. Those are the student. Don't forget our the daily practice. How can reduce the minimum exposure to the patient? How can effectively communicate the patient? How can handle our the machine gently and improvement our the day-to-day practice. Don't forget and continue stay update your the new technology and learn from the new things also.
Thank you for appreciating us, sir. If there are no further questions, we can wind up the session. Thank you, sir, for sharing your knowledge with us on recent advancements and emerging trends in radiation therapy and imaging, and how these innovations have enhanced patient safety and comfort during therapeutic procedures. It was an amusing topic, and I'm sure the participants obtained a lot of information from your session. If anyone has missed any session, please note that the recordings will be made available on YouTube soon. Thank you once again, sir, and thank all the participants for your active participation today. Before we conclude, let me briefly inform the participants about the next session tomorrow. We will have with us Mr. Shashikumar Shetty, Assistant Professor and Coordinator, Department of Medical Imaging Technology, KS Hegde Medical Academy, Nitya University, Bangalore, Karnataka, who will be talking on NCAHP Act Medical Imaging Technology Perspective. See you all tomorrow at 11 a.m. Until then, stay safe, take care, and have a great day.
Thank you so much. Thank you. All best wishes.